5 signs of food poisoning and 5 emergency first aid steps. Food poisoning can happen to anyone, anywhere, whether at home, in a restaurant, or at an event. Knowing the signs and quick first aid steps can save health, time, and even lives. Let's break it down into 5 key signs and 5 emergency first aid actions you must know. 1. Severe stomach pain and cramps. One of the first and most common signs of food poisoning is sharp stomach pain or cramps. This happens when harmful bacteria or toxins irritate the digestive system. The pain can range from mild discomfort to severe cramping, often coming in waves. If someone suddenly starts complaining about stomach pain after eating, food poisoning should be suspected immediately. 2. Nausea and vomiting. Nausea often starts within hours of eating contaminated food, followed by vomiting. This is the body's way of trying to expel harmful substances. Continuous vomiting can quickly lead to dehydration, especially in children and older adults, so it's a major warning sign. 3. Diarrhea, sometimes bloody. Loose or watery stools are another classic symptom. In severe food poisoning, diarrhea may contain mucus or even blood. This indicates that the intestinal lining is irritated or infected. Frequent diarrhea can cause loss of fluids and electrolytes, making emergency care necessary. 4. Fever and chills. A sudden rise in temperature, along with chills, shows that the body's immune system is fighting off an infection. While mild fever can be normal, a high fever above 101 degrees Fahrenheit or 38.3 degrees Celsius, combined with other symptoms, points strongly to food poisoning. 5. Weakness, dizziness, or dehydration. As vomiting and diarrhea continue, the body loses water and essential salts. This causes weakness, dry mouth, dizziness, and even fainting in extreme cases. Dehydration is one of the most dangerous complications of food poisoning and needs to be addressed immediately. 5 emergency first aid steps for food poisoning. 1. Hydrate immediately. The first and most important step is to replace lost fluids. Give the patient plenty of clean water or oral rehydration solutions, ORS, to restore salts and minerals lost through vomiting and diarrhea. Sip slowly but frequently. Avoid sugary drinks, alcohol, or caffeine because they worsen dehydration. 2. Encourage rest and monitor symptoms. Make the patient lie down in a comfortable position to conserve energy. Rest helps the body fight infection. Keep a close watch on symptoms such as urine output, skin color, and level of alertness. If the patient stops urinating or becomes drowsy, dehydration may be severe. 3. Avoid solid food until nausea settles. Do not give heavy, oily, or spicy foods immediately. Start with bland, soft foods like bananas, rice, toast, or clear soups once vomiting stops. This helps the digestive system recover. For babies, continue breastfeeding but in smaller, more frequent feeds. 4. Use safe over-the-counter medicines with caution. Anti-diarrheal medications or painkillers should be used only if recommended by a doctor or healthcare professional. In some cases, stopping diarrhea can trap bacteria inside the gut and worsen the infection. Focus first on fluids and rest. 5. Seek medical help for severe symptoms. Immediate medical attention is necessary if vomiting or diarrhea lasts more than 24 hours. There is blood in stool or vomit. The patient has a high fever or severe dehydration. A child, pregnant woman, or elderly person is affected. Do not hesitate to call emergency services or go to the hospital if the condition worsens. Early medical care can prevent serious complications like kidney damage or sepsis. Conclusion: call to action. Food poisoning can strike without warning, but recognizing its 5 key signs and taking 5 quick first aid steps can protect health and even save lives. Always wash hands before cooking, store food at safe temperatures, and check expiry dates to prevent foodborne illnesses in the first place.